Here is statin gaslighting video number 2. Hi, my name's Brian and I practiced medicine for 30 years and became a health coach in 2017. We're doing a review from another platform and another physician talking about 8 myths and misconceptions about statin use. Myth number 2, statins can lead to liver and kidney damage. And the listed fact from this physician is it is rare that statins will cause a serious liver problem, and there is no evidence that proves statins can cause an adverse effect on the kidney. So let's break those down into two myths, so 2A and 2B. So statins causing liver injury. Well, one of the more common adverse effects of statins is liver problems, and specifically transaminitis, which is an elevation of two liver enzymes known as ALT and AST. ALT is more specific since it's only produced in the liver, and 20% of your cell membrane is made up of cholesterol. So if you lower cholesterol in liver cells, then those enzymes can leak into your bloodstream and raise those levels. An increase in those two enzymes are considered hepatocellular damage. It does seem to be transient, but it is dose dependent. So higher doses for longer periods of time can increase those enzymes for a longer period of time. Increases in ALT and AST are reported around 10% of patients taking statins. But to be fair to the doctor, serious liver injury is about 1%. But if you look at the criteria for how you use those words from the EMA, which is the FDA in Europe, a common side effect is considered 1 to 10% of the population. So 10% with statin use, and I've seen as high as 35%. And then uncommon is 1%. Certainly doesn't meet the criteria for a rare complication. So if you were drinking alcohol and your doctor noticed an elevation in those enzymes, they would tell you to stop drinking because you're damaging your liver. If that is happening with statin use, and let's say you're not drinking, they will tell you that it's probably transient and clinically insignificant. Keep taking your statin. Interestingly, we have an epidemic of non-alcoholic fatty liver disease, which kind of does the same thing, and statins seem to improve that condition, probably through its mild anti-inflammatory effect. However, you can reverse fatty liver disease by changing your way of eating, what you're eating, how often you're eating, and that's going to do much more to prevent cardiovascular disease than taking a statin, which reduces that absolute risk of heart attack by about 1%. The second myth, that statins cause kidney injury, is in fact a myth. There is no evidence that statins cause kidney injury, and in fact, it seems to slow the progression or the decline of kidney function that occurs when you age. So there are my thoughts on statin gaslighting number 2. Number 3 is tomorrow. Have a great evening, and I'll talk to you later. Bye.